So hi everyone. So today we will be discussing about the forensic medicine questions that had appeared in the just yesterday concluded NEET 2021 PG examinations. Okay, a few what you can say happier things to be noted here. First of all, the examination seemed to be not that difficult. Second happier thing, forensic medicine did have a good number of questions, good number of representation, 10 to 11 questions about. And third, all the questions of forensic medicine were non-confusing, direct, with crisp answers. And the last, but the important, what I would like to, the happiness which I would like to share here is all the questions of forensic medicine which did appear in 2021 NEET examinations were from the notes that were provided by eGurukul. So eGurukul notes completely covers all the questions that did appear in NEET 2020 examination. The strike rate remains 100% still and again, right? So with that, we shall discuss all the forensic medicine questions that had appeared in the recently concluded NEET 2021 examination. Let's start with the first one. And before I start, I put out a disclaimer again. These are memory-based or memory recall questions. So the questions might not be the actual verbatim of what exactly appeared in your examination, but definitely the gist of the questions. Gist of the question is definitely what it is, which did appear in the examination. With that, let's move to the very first question. Well, somehow the examiners seem to be, I'm a bit amazed that they are obsessed with this image-based question pertaining to marbling. So pertaining to marbling of veins, they're a bit obsessed with that, and including that one which is similar to this, the lightning changes. They're obsessed with even that. I'll show you both of them. Anyways, well, so what are these? So you can very clearly see the changes over here, the changes over here. So there was an image which did show some changes which I'm showing over here. So what are they? Invariably, these are marbling of veins. So these are marbling. So plainly referred as marbling or called as marbling of veins. So just to reiterate, so these did appear. It's again, I'll just take you the highlighter. So parallelly, I will also be showing you the screenshot taken from the notes of the eGurukul, which clearly shows everything that appeared in the NEET examination were from the notes. Okay. So yes, this in fact is marbling of veins. So what is marbling? It is a tortuous, meaning irregular. It's an irregular network of discolored veins. So there is no regularity in that. It's absolutely irregular, a network of discolored veins. It's irregular or a tortuous network of discolored veins. Reddish brown in color or greenish in color. Reddish brown or it might be even greenish in color. Okay. Now, so what exactly? It looks like it has a marbled appearance. It has a marbled appearance. So most commonly seen over the roots of the limbs, abdomen and flank, and most importantly, well established by 36 to 48 hours. This is the very important point. So well established marbling of veins is seen by 36 to 48 hours. So option C and D, I'm not very sure what exactly they were. So among the given options, and definitely I'm very sure the correct option here was these marbling of veins was due to self-methemoglobin. So self-methemoglobin. So what happens here? So marbling of veins, few of the points. So marbling of veins most importantly indicates the time since death of 36 to 48 hours. 36 to 48 hours, that's very important, repeatedly asked question. A well-established marbling of veins indicates time since death 36 to 48 hours. So why is this due to? So during the time of putrefaction, lot of gases evolve, and the one which we are most interested with is H2S. So H2S combines with hemoglobin to produce self-methemoglobin, and this self-methemoglobin is the reason for discoloration of veins. So this discolored network of veins, what we see is marbling of veins. Okay, so marbling, a repeated question for you. Important point to be known: 36 to 48 hours and self-methemoglobin. Now, another points to remember regarding putrefaction is the most important organism for putrefaction, what we call as the culprit, Clostridium welshi, the chief destructive agent which produces lecithinase. This is also question. Chief destructive agent Clostridium welshi or welshi producing lecithinase. The last organ to decompose, a repeated question in case of males, prostate, females, uterus or virgin uterus to be more specific. Now, the point to remember here is if at all bone is an option, if at all bone is given as an option, whether it's male or a female, obviously the last organ to decompose will be bone, Bone not being an option, in males it is prostate, females it is going to be uterus. Okay. Then another important point, again a repeated question for you here is Casper dictum, very frequently asked. What is Casper dictum? Casper dictum is the rate of decomposition. So the rate of decomposition of a dead body in air, water and earth. So in air, water and earth. If the time taken by a dead body to undergo decomposition in air, if it is X, so if the same dead body were to be placed in water, the time taken by the body to undergo the same amount of decomposition will be 2x. If the same body were to be placed within the soil, buried within the soil, the time taken for decomposition will be 8x, 8 times the amount. So air is to water is to earth, 1 is to 2 is to 8. Fastest in air, slowest when it is within the earth. Okay. All these are repeated questions for you. I discussed all those questions with respect to this particular photograph. And now I'm going to show you how we can get confused with this marbling photograph with that of the Filigree Burns. Filigree Burns. So Filigree Burns, also known as arborescent markings. In fact, the word burns itself is a misnomer. The actual or correct word would be markings or Lichtenberg flowers, also known as Lichtenberg flowers. These are the typical appearances. So these are the typical appearances of lightning injuries. The injuries that are seen due to lightning are referred as Filigree Burns, arborescent markings or Lichtenberg flowers, and these have a very specific pattern for them. They have a very specific pattern. They resemble the branches of a fern tree, something like this. Branches of a fern tree. So they resemble the branches of a tree. They do have a very specific pattern. Very clearly you can see them over here. They do have the pattern. Very clearly it can be seen. Unlike marbling of veins, which is a tortuous, that is irregular, there is no pattern. And marbling is definitely due to discoloration of veins, whereas arborescent markings, there is no vein or the vascular channels that are involved here. Now, few points regarding that. Let's take a highlight. Yes. So the most specific for lightning injuries, the superficial irregular markings which resemble branches of a tree or of a fern, most commonly seen over the shoulders and flanks and of the chest. They represent the path taken by the electric current of lightning. So along the path taken by the current, there will be hemolysis. Hemoglobin comes out. So this hemoglobin stains the tissues. So this staining is represented as markings over here. So if the person survives, it gets resolved by itself by 1 to 2 days. Okay. So mechanism of formation, which is explained now, rupture of small vessels along the path due to hemolysis. Obviously, hemoglobin comes out, and also is believed to be due to deposition of copper along the path of discharge. Okay. So don't ever get confused with marbling and Lichtenberg flowers. So let's move to the next question. Yes, so the question here was the active principle of this poisoning. Let me take a pen over here. Yes, so the active principle of this poisoning. First, let's identify what is the poisoning. So the one which is this is the photograph that was given. So definitely it is semicarpus anacardium. Semicarpus anacardium, also called as, in a simple language, marking nuts. Semicarpus anacardium or marking nuts. Again, it's a repeated question. We did discuss. So the active principle of this, it has two active principles. Okay, it has two active principles: semicarpol and bilavanol. Mainly bilavanol. About 15 to 17%. 15 to 17% is due to, the content is bilavanol. Okay, so semicarpol and bilavanol are the main active principles of this. So among the given options, the answer definitely is bilavanol. Bilavanol is the option. Now, what is the medical legal importance of this semicarpus anacardium? So medical legal importance, it has two important medical legal significances. One, this is used to produce artificial bruises. So this is used to produce artificial bruises. Okay. That is, what do they do in order to go for a false claim? In order to claim that someone has assaulted this person uses small amount of the juice of this marking nut or semicarpus anacardium. He smears it over his limbs or on some parts of the body. After a few minutes, the entire area becomes reddish, which appears like a contusion, which appears like a bruise. So to produce such pseudo bruises, these are used. And also the second importance, it is also used for criminal abortion. Criminal abortion. So both of these are repeatedly asked questions. Criminal abortion, how do they use it? So abortion stick. So the abortion stick is used, and the abortion stick is dipped into the juice of this marking nut and it is introduced into the vagina. So for illegal criminal abortions, the juice of semicarpus is used. Now, if you look into the other options, abrin and ricin, again, very important questions for us. Very important questions for us. Let's discuss that. Abrin is obtained from Abrus precatorius. So this is Abrus precatorius. So Abrus precatorius, from which the active principle of this is abrin. Active principle is abrin. So very clearly you can see over there in the photograph, these are egg-shaped seeds, a beautiful scarlet red color with a jet black tip. Okay. Now, what is the medical legal? Of course, in olden times, these were used in order to weigh the gold. It's referred as pulganji, isn't it? Well, the medical legal significance of this is this Abrus precatorius is used for homicidal purposes. I'll just take note with that for better understanding. Okay, yeah. So let's just take note. So Abrus precatorius. So abrin is the active principle. It is used for homicidal purposes. Homicidal purposes. How? How is it used for homicidal purposes? By production of what we call as suis. Sui. Sui meaning needle, right? Sui meaning needle. Why? Why it is used for homicidal purposes? The reason being, abrin, when injected, resembles viper snake bite. Abrin, when injected, resembles viper snake bite. So this is the reason it resembles viper snake bite. Now what do they do is they decorticate the seeds, they powder these seeds, they mix the powder of this Abrus precatorius with water, spirit, onion, datura, if available even cannabis. They mix with all this and they make a thick paste out of that. Now this paste, they convert this paste into the shape of a needle, what we call as suis. They convert the paste into the shape of a needle, after which they dry this in the sun. So once they're dried enough and hard enough, what do? They take a long stick, fix two suis in front of that. Okay, and this long stick, what do? They use this stick or they thrust this stick with two needles upon the cattle or the goat or the animals of the person upon whom they want to take a revenge upon. So two needles, they thrust it onto the animals, they produce two puncture holes very much resembling the fang marks of a snake. So as we just discussed, once abrin is injected, it resembles viper snake bite. So the animal starts bleeding from everywhere. There will be intense local reactions, cellulitis, gangrene. Death happens by 24 to 48 hours because of hemorrhagic shock. And the owner is going to think the death is due to a snake bite. Sometimes these suis are held in between the fingers and person is slapped. So this is how it is used for homicidal purposes. The reason being is it resembles, when injected, viper snake bite. Okay. So let's come back to this. So that's about Abrus precatorius. And what are these two? So this is Ricinus communis. Ricinus communis. Okay. Ricin or Ricinus communis. So these, what you are seeing, two photographs. One is these of Ricinus communis seeds. So these are the seeds, and this is about the plant. Ricinus communis seeds. Ricin is the active principle. All the parts of the plant are poisonous. All parts of the plant are poisonous except oil, castor oil. Castor oil, which is obtained from Ricinus communis, is not poisonous. So castor oil is non-poisonous. Except castor oil, each and every part of the plant is poisonous. In fact, ricin is believed to be a potential terrorist weapon. Okay, so this is the photograph of the image of ricin seeds and the plant. Okay, all of these are repeated questions for you. Let's move to the next question now. While playing, a child accidentally consumes or bites a fruit, following which he develops irritability, dry skin, increased temperature, retention of urine. What is the poison and what is the antidote for the poison? So very clearly, accidentally bites a fruit. I'm very skeptical whether the word given was fruit, because this is definitely datura, and datura fruits, they are thorn apple, and I don't think a child can consume a fruit. Probably the child might have, see, every part of the plant is toxic. Every part of the plant is toxic, whether it is a fruit or a leaf or a flower. Everything is toxic, particularly the seeds. But everything is toxic. Probably I feel some part of the plant might have been consumed. If something which looks very colorful, probably the flower. Okay, so increased temperature, dry skin, irritability, definitely it is nothing but datura. It is nothing but datura. No doubt it is datura, and the specific antidote is physostigmine. Datura and physostigmine is definitely the answer. Okay, now what is the active principle? So let's discuss something about datura. Active principle, again I've taken the taken it from notes, directly from the notes. So hyoscine or scopolamine, hyosamine, atropine, these are the active principles. Clinical features, as you know, everything starts with D, isn't it? Everything it starts with D. So delirium, for easy understanding, we just discuss everything which starts from the D. Yes. So delirium, diplopia, dimness of vision, dilatation of pupils, dryness of mouth, dysphagia, dysphonia, dilatation of the cutaneous vessels, drunken gait. Well, in addition to this, you can also add dysphagia, dysphonia, even dysuria. So dysuria. So there will be difficulty in passing urination. There will be retention of urine. There will be tachycardia. Okay, there will be tachycardia. Right. All these are the clinical features associated with that. Very clearly, irritability. So there will be irritability, dry skin, increased temperature, retention of urine. Clearly going in favor of datura. Okay. Now, a few points regarding datura, which I would like to quote here. One is delirium. See, the delirium which is associated with datura, we have given it name as what we call as muttering delirium. Muttering. It's in fact referred as muttering delirium. Just write it here. Sometimes it's referred as muttering type of delirium associated with carphologia. I'll just take the take note. Probably some of you will not be able to see when it is behind me. Well, so the delirium here is associated with what is called as carphologia. Carphologia. Carphologia is picking up imaginary threads, or what in general we can call it as purposeless movements. So, what are the purposeless movements that are seen in case of datura? So picking up imaginary clothes, pill rolling movements, these are the ones. And picking up imaginary threads is the one which is very frequently asked for us. So these people, they get up on the bed, particularly from the bed clothes, very seriously, they'll be pulling out imaginary threads. Now from the tips of the fingers, they start pulling out imaginary threads from the tips of the fingers. They'll be trying to thread an imaginary needle very seriously. Imaginary needle, they'll be trying to thread an imaginary needle. So carphologia is picking up imaginary threads associated with the delirium produced by datura. Okay, delirium produced by datura. Now, what is the medical legal? Let's go to the other points to be known here. Fatal dose 100 to fatal dose. Just write it here. 100 to 125 seats. 100 to 125 seats are is the fatal dose. Fatal period, yes, 24 hours. 24 hours, yeah. Specific antidote. Again, that was the question. Specific antidote. I'll just take a highlighter. Yeah. Specific antidote being physostigmine. No doubt. Specific antidote for atropine, physostigmine. Medical legal importance. This is a repeated question. Rape, robbery, or kidnap. To produce stupefaction for rape, robbery, or kidnap. Well, so this the scenario goes like this. The scenario itself is a question for you many a times. So when people are moving in a large crowd, particularly let's say in a train, at certain junctions, some people get into the bogies. They become be friendly with the co-passengers. Offer the co-passengers the rotis or the chapatis wherein atta is mixed with datura powder. Or offer these passengers bidis or cigarettes wherein the tambaku is taken out and stuffed with datura powder. So upon consuming datura in any of this form, this person goes into a stage what we call as twilight stage, or what is also known as stupefaction. So during the stupefaction stage, this person does not show resistance to anything. In front of him, his own belongings have been looted. It doesn't show resistance. So it helps in robbery. So female under the influence of datura does not show any resistance for sexual assault. Helps in the offense of rape. So they sprinkle this datura powder on ice creams or ice candy and offer it to the kids. So once they consume it, they easily follow the kidnappers without crying or making any fuss. Helps in kidnap. So this is the main medical legal importance of datura for producing stupefaction to aid in rape, robbery, or kidnap. Also definitely referred as roadside poison. Roadside poison. A person who acts under the influence of datura, that is, it's involuntary intoxication, dealt under 84 85 IPC, he shall not be held responsible. Conduct under involuntary intoxication. Acts done under involuntary intoxication not punishable 85. Done under voluntary intoxication punishable under 86. So involuntary intoxication 85, under datura not punishable. Okay. So some of the photographs, yes. So this is the fruit of datura. As I was telling you, I am very skeptical whether the child had consumed this fruit. Well, it might have been these flowers, some bright looking flowers, as all the parts of the plant are poisonous, particularly so the seeds. Okay. Let's move to the next question. That was datura and physostigmine. A patient who has abstained from consuming alcohol for past 3 days presents to the emergency with, let's analyze the question. So he was an alcoholic who has suddenly abstained or suddenly stopped drinking since past 3 days, or sometimes the question may be even 4 days or 3 to 4 days. Okay, fine. He presents to the emergency with irritability, disorientation, altered sensorium. So the diagnosis, so definitely is delirium tremens. I'm not very sure what were the options. Okay, so the answer is definitely delirium tremens. This is a direct question. A direct question. Okay, so delirium tremens. Just take highlight. Yeah. So delirium tremens typically seen 72 to 96 hours or 3 to 4 days after the withdrawal of alcohol, sudden withdrawal of alcohol. How do they present with? Yes, coarse tremors, irrational fear, fear for anything and everything. They're very much fearful. Irrational fear, vivid and wild hallucinations, delusions of horror, disorientation. Now, because of all this, that is irrational fear, vivid hallucinations, delusions of horror. Now, this has now been diagnosed as an acute attack of insanity, and hence has been brought under the purview of section 84 of IPC. A repeated question. A person who is diagnosed to be suffering from delirium tremens now legally is dealt under 84 of IPC. That is to say, the actions by the person who is diagnosed to be suffering from delirium tremens shall not be considered as an offense. Shall not be considered as an offense. So that is the medical legal importance. A repeated question. It is now considered as an acute attack of insanity, thereby being brought under 84 IPC, thus making this person not guilty for his actions under 84 of IPC. Delirium tremens. Okay, repeated question. Let's move to the next question. Well, the question goes like this. A daily wages laborer, I'll just take a pen over here. Yeah. Daily wages laborer working in the sun for a very long time. Okay. Collapse suddenly. His temperature, this is important. Temperature was 105 Fahrenheit. Somewhere comes to about 40 to 41 degrees Celsius. So if you convert this, it is easier at about 40 to 41 degrees Celsius. Okay. Fine. Which of the symptoms is least likely to be seen? Least likely to be seen. What exactly is this? So when the temperature is so much increased, it has to be nothing but heat stroke. It has to be, I'll just take highlighter. Yeah, it has to be heat stroke. It is heat stroke. So in heat stroke, there is complete absence of sweating. There is complete absence of sweating. So the answer for this will be the least likely to be seen is sweating. Sweating is not seen. Sweating is not seen. So there might be a bit of confusion with you between heat stroke, heat cramps, heat syncope. They seem similar. So I've taken again the screenshot from our notes. So very clearly, so my notes is going to tell you what exactly are the findings in all of them. So heat stroke, it's also called as sunstroke, prolonged exposure to high temperature with high humidity and increased muscular activity. So the requirements, high temperature, working in high temperature for a long time where there is increased muscular activity, right? So what happens? There is failure of heat regulating mechanism of hypothalamus, failure of heat regulating mechanism. So because of this failure of heat regulating mechanism, there is failure of cutaneous vasodilatation, which leads to complete absence of sweating. Complete absence of sweating. So there is an increased body temperature to the extent of up to 41. So rectal temperature, as the theory says, is more than 40 or more than 41 degrees centigrade. So there is immense increase in the temperature, core temperature of the body. Okay. So it is sudden in onset, sudden collapse with loss of consciousness. Treatment, ice water bath. Pupils are constricted. Pupils are constricted. Note this point, because in heat cramps and heat syncope, pupils are dilated. Whereas in heat stroke, pupils are constricted. That was also a question once for you. Okay. Now, this is about heat stroke. The answer is there is absence of sweating. So sweating is least likely to be one of the symptom. Now, what is heat cramp? Is what we commonly see. That is also called as minor cramps or stroke cramps. So prolonged exposure to heat with muscular activity. So prolonged exposure to heat. What happens here? There is extreme sweating, severe and profuse sweating. So the severe and profuse sweating leads to severe dehydration and loss of fluids. So painful cramps. So this causes painful cramps of the limbs and abdomen, rapid relief by rehydration, and the pupils are dilated. So extreme, what you can say, exposure to heat, lot of work, severe sweating. So there is dehydration, cramps, relief by rehydration. Okay, that's it. Then heat syncope. Heat syncope, also called as heat exhaustion or heat prostration. So what happens here? Similar, the situation, the basic environmental condition for all of these three is the same. Prolonged exposure to high temperature with increased muscular activity. Okay. Sudden peripheral vascular collapse. Sudden peripheral vascular collapse. So what will be there? Person suddenly feels weak, giddy, and falls. Okay. So sudden peripheral vascular collapse. He feels giddy and suddenly falls. Usually recovers by rest. Okay. Usually recovers by rest. Okay. So this is heat syncope. So heat stroke, sunstroke, absolutely no sweating. Heat cramps, excessive sweating. Heat syncope, sudden peripheral vascular collapse. Okay. Let's move to the next question. A man sits in his balcony naked every day. A pervert, obviously, naked every day. And that balcony overlooks a park. So the neighbors have complained to the police frequently. What is the likely diagnosis? Now, here is a person, a pervert, who, what you can say, gets sexual gratification by exposing himself. By exposing himself. Definitely the answer is exhibitionism. So he gets sexual gratification by exposing his genitals, particularly to very specific, by exposing his genitals. Exhibitionism, almost always seen in case of males. Almost always seen in the case of males. So some points regarding exhibitionism. It is dealt under section 294 of IPC. Exhibitionism 294 of IPC, for which the punishment is imprisonment up to 3 months. Imprisonment up to 3 months. Most commonly seen in males, he exposes his genitals in the public to derive sexual gratification. Okay. Now, what is voyeurism? Voyeurism, what we also call as peeping Tom, isn't it? Voyeurism, also referred as peeping Tom. Okay. So, watching a person undressing or watching two people involved in intimate physical intimacy. Voyeurism. Masochism, well, masochism and sadism, what you can say, opposite to each other. Sadism is a condition wherein the person inflicts the pain or the injury upon his partner to derive sexual gratification. Masochism is exactly opposite to that, wherein he wants his partner to inflict injury upon himself to get the sexual gratification. Okay, fetishism is by what you can say, by stealing the inner garments of that of the opposite sex, again most commonly seen in case of males, fetishist. So stealing the undergarments and they get sexual gratification from that. Okay, well, it's a direct question again, very direct question. Next question, what is the injury which is seen here? So there was a photograph, an image based one. Now I want to reiterate here that all the students of eGurukul who have attended our vibe session, visual image based session, definitely would have been immensely benefited by all these image based questions. Immensely benefited, I would say. Okay, because all these image based questions were in detail discussed in the vibe session. Okay, now what is this injury seen here? There was certain photograph wherein there was an injury on the head which very much looked like an incised wound. Okay, so this was the injuries what you are seeing here. These injuries. So this was an incised looking laceration. This is the correct answer. It was an incised looking laceration. That is to say, it is a laceration which looks like an incised wound. Then what is it? It is a split laceration. Split laceration. So split laceration is most commonly seen on those areas of the body wherein immediately beneath the skin there is a bone. So those areas of the body wherein the skin gets sandwiched between two hard objects, the weapon, that is weapon of offense, a hard object, and also the underlying bone. So because of which the skin splits up or split opens, which very much resembles like that of an incised wound. So this is a split laceration. Well, I'll just take the highlighter. Yeah, it is a split laceration which are seen when the skin is crushed between two hard objects, seen immediate in the areas where the skin is immediately beneath the skin there is a bone like scalp, forehead, knee, shin. These are the areas, and this is the medical legal importance. They resemble incised wounds. They resemble incised wounds. Okay. Now few other points regarding split laceration. Probably this was the photograph, something like this. Okay, I think that was the photograph which was given. Now the difference between split laceration and an incised wound, frequently asked question. Frequently asked question for us. I'll take the pen for this. Okay, the first criteria. Again, I've taken it from notes. Okay, everything is very clearly given in detail, explained in the notes. Okay, so the margins. So split laceration has ragged margins like this. That is wavy margins or called as ragged margins. Whereas incised wound, clean cut, no waviness of the margin, clean cut margin. Now, abrasions and contusions are found along the margin. See, split laceration being a injury caused by a blunt weapon, invariably there will be abrasions and contusions along these margins. They are definitely present. Whereas incised wound being caused by sharp weapon, so there will be no abrasions and contusions along the margins. Okay. Now tissue bridges. See, tissue bridges meaning, see, let's say this is the split laceration. I'll just take the different color pen here. Yeah, tissue bridges are the one which makes the floor of the structures which make the floor of the injury, like the muscle fiber or a tendon or a blood vessel or a nerve fiber. So these are called as contents of the injury or tissue bridges. So these tissue bridges definitely are crushed in split laceration. They are clean cut in incised wound. For the same reason, hemorrhage is profuse in case of incised wound, hemorrhage is less in case of split laceration, because the vessels are crushed in split laceration, the vessels are clean cut in case of incised wounds. Okay, the hair again is crushed, it's clean cut in incised. Now in incised wounds, swallowtails, I'm sorry, in split laceration, very important one, you need to know about this, frequently asked. See, even the what you can say, the momentum of impact is very fast, or the momentum is very forceful at times, not always, at times. It so happens that from the tips of these injuries, small lacerations pop out perpendicular to the main laceration. So when the impact is forceful, small lacerations perpendicular to the main laceration pop out from the angles of the tips of the split laceration. These are called as swallowtails. So these are called as swallowtails. So swallowtails are seen, if you remember this is enough, swallowtails are seen in laceration, split laceration. Tailing of a wound is seen in incised wounds, and fish tailing or fish tails are seen in stab injuries. So there are three tails in mechanical injuries. Each of that is a question. I'll come again. Swallowtails, laceration, split laceration, tailing of an injury, incised wound. Fish tailing or fish tails is seen with stab injury, particularly being caused by a single-edged weapon. Fish tailing, stab injury, single-edged weapon. Okay, so all these are the very important points that you need to know regarding split laceration. Now, there's one more option here. Incised looking laceration. A laceration looking incision, that is an incised wound which looks like a laceration. Where does this happen? So, incised wound or incisions over scrotum. So, incision over the scrotum and axilla. So, incision over scrotum and axilla does look like a lacerated wound because of increased thickness of the skin and increased folds of the skin. Incised wounds on these areas, they very much resemble lacerated wounds. This is also a question for you. Okay, fine. So this was about the split laceration. Let's move to the next question. Well, the question goes like this. In a court, if a lawyer asks the witness, so the lawyer is posing the question to the witness. What is the question? Did you see A, the person here is A, killing B? So such type of questioning is permitted during. First of all, what is this questioning? What is he saying? He is asking, have you seen Mr. A stabbing Mr. B? That is to say, he himself is suggesting an answer for the question here. He is leading towards the answer. The question itself leads towards the answer. So this is called as leading question. So what is a leading question? A question which leads to an answer by itself. Okay. He could have asked, have you seen, what you can say, what did you see on that day? What did you see on that day? Did you see anyone killing the deceased person? He could have asked that. That's a non-leading question. So directly is asking whether has he seen A stabbing or killing Mr. B. Okay, so this is called as a leading question. So leading questions are permitted only in cross-examination. So leading questions are permitted only in cross-examination. It's a repeated question. It's a repeated question. Okay. Now let us look into the notes, the important points that you got to remember with this particular question. Now, first of all, the very important point that you got to remember here is what are the different types of examination that is done when a witness goes to the court. First of all, chief examination in chief, also called as direct examination. Now, chief examination is done by or it is conducted by the lawyer or the advocate who has called the witness to the court. So the lawyer or the advocate who has called the witness to the court, he examines the witness first. So that is called as chief examination. Okay. Followed by the defense lawyer, or what we call as the lawyer of the opposite party. Okay. What we call as cross examination. Followed by redirect. That is, again the first lawyer comes back if at all some points have to be told. Again, recross. These are the four basic what you can say procedure of examination of a witness: chief, cross, re-chief, recross. Okay. So leading questions are permitted only in cross-examination. Now, a few points regarding leading questions. So the definition of the leading question is given under section 141 of Indian Evidence Act. So section 141 defines of Indian Evidence Act defines what you can call the leading question. Section 142 of Indian Evidence Act, 142, probably again this might go behind my back. I'll just take the pen for over here. So section 141 of Indian Evidence Act defines leading question. 142 of Indian Evidence Act says where leading question is not permitted. Where it is not permitted. It is not permitted in chief examination. But there is an exception here. Very important exception which is frequently asked as a question. It is not permitted in chief examination, yes. But the exception is it is permitted when the witness becomes hostile. So just take another pen. Yeah. Well, so in chief examination, leading questions are permitted in chief examination when the witness becomes hostile. So if the witness becomes hostile, he starts giving statements which are totally contradictory to his own statements. So his own words or own statements which he had given, once he starts changing his statements, then he's referred or called as hostile. So when he becomes hostile, yes, even in chief examination, leading questions are permitted, or else they are never permitted. Okay. So on 143, lastly, 143 of Indian Evidence Act says where leading questions are permitted. So they are permitted only in cross examination. Only in cross examination. Single best answer, cross examination. Okay. Fine. Let's move to the next question now. So some photograph was given again. Again, I would say vibe session is very important for those students who are seeing this and who are probably appearing the fresh graduates or who are preparing themselves for the next year's NEET examination. Well, I would say vibe session is very vital, very vital. Now there was an image which showed something like this. So a foot of the people. Now most of these photographs are from those cases from which I have conducted my autopsies on my own. Okay, so after these many years of 16 to 17 years after conducting thousands of autopsies, definitely there are a good collection of photographs which I'll be showing it to you during vibe session, which does help you in solving such type of questions. Now, a foot. Something of the image of the foot wherein the skin of the foot was bleached, it was wrinkled, and it was soddened. Very clearly it is nothing but washerman's hands or washerman's foot or washerwoman's foot, washerman's or washerwoman's foot. Okay, so this is the one, and the question was, okay, the phenomenon seen in the image was due to torture in the hot water, definitely not. Post-mortem hanging, definitely not. Immersion in water for 36 hours, fine. So basically such changes, what we call as washerwoman's hands or foot, soddening, bleaching, wrinkling of the skin of the palm and the sole. So this does appear after 24 hours. Once the dead body is placed in water for about 24 hours or even beyond that, so there is appearance of this. Now, what is the medical legal importance of this? Very important, you got to remember. See, medical legal importance of this is this does not signify anything. The important point, this washerwoman's hands does not signify whether it is ante-mortem or post-mortem drowning. No, because this can be seen even when a dead body is thrown into water. It definitely can be seen even when a dead body is thrown into water. And hence, this is a feature of drowning, but not a feature of ante-mortem drowning. See, this washerwoman's hands and feet, along with, there is one more called as cutis and serina. Cutis and serina. See, these two are external features of drowning. Okay, external features of drowning. Cutis and serina is nothing but goose skin or goosebumps, what we call as goose skin. There will be contraction of the erector pili muscles, as a result of which the hair strands, they get erected. Okay, they get erected. Now these two features, washerwoman's hands and feet and cutis and serina, They are features of drowning, but not the features of antemortem drowning. Not the features of antemortem drowning. Then what are the external features of antemortem drowning? Repeated question. These two. These two. Now, here is a very rare photograph I would like to call, wherein a single photograph shows both very, very important signs of antemortem drowning. What is that? Froth, and cadaveric spasm. So both froth plus cadaveric spasm is seen in a single photograph. I always keep saying this word. This can be diagnosed from a distance. This can be diagnosed from a distance. These two are very, very vital features of antemortem drowning. Froth and cadaveric spasm. Very clearly you can see. So these photographs are also repeatedly asked questions for. Okay. So externally there are 4 findings. Froth and cadaveric spasm are definitely the features of antemortem drowning. These two are definitely the features of antemortem drowning, whereas these two, washerwoman's hands and QT sensorina, they are features of drowning, but not the features of antemortem drowning. Okay. Well, so important. Moving on to the next question. A woman gave birth to twins. Father alleged that the children does not belong to him. Paternity issues. DNA test reveals that one of the twin child belongs to him, while the other does not. Okay, so twins are born. Father says both of those kids or children doesn't belong to him. DNA analysis done, which clearly shows one of the child he is the father of definitely one of the child. For the other child is definitely not the father. What is this called as? This condition called as? So this condition is definitely called as superfecundation. Superfecundation. I'll discuss about the other options also. Superfecundation. Again, I've directly taken it from the notes. What is superfecundation? Superfecundation, very simple. Then I'll go on just explaining the notes. Same cycle, 2 ova are released, both are fertilized by 2 different acts of coitus happening at short intervals. So 2 ova released in the same cycle being fertilized by 2 different acts of coitus happening at very short intervals. Now, there lies the medical legal importance. Those 2 different acts of coitus may be, can be, could be from 2 different people. So 2 different people, thereby, so one of the child, so 2 different people will be fathering the 2 twins. I mean the twins in that case. Superfecundation. So what is superfecundation? So as I said, 2 ova released in the same cycle. So in such a condition, incidence of twin pregnancy is just 1.5%. In just 1.5%. In rest of the 98-99% of the cases, one of the fetus definitely dies. So one of the fetus dies, the other fetus goes on well developing. So this well developing fetus goes on compressing the dead fetus. So thereby the dead fetus, as it is constantly getting compressed, the entire body of this dead fetus gets compressed, gets flattened up, or gets totally compressed. What is called as fetus pepiraceous or fetus compressus. Fetus pepiraceous or fetus compressus. Okay. So in about 98 to 99% of the cases, this happens. In about 1.5 cases, it goes into twin pregnancy. And in that twin pregnancy, there is a chances that one of the baby, I mean these 2 babies being fathered by 2 different people. 2 different people. So that is superfecundation. Now, what is superfetation then? Superfetation. Now, if this was also, if it were to be option, then the confusion would have arisen. So there would be intense confusion if this was also give us an option. As per the options, as per the recall options given by the students. So I mean, I can say this was not an option. I suppose this was not an option. Okay. Why? Because see, the same thing happens in superfetation. Super fetus. So there is already one fetus in the womb, that is, she is already a pregnant. The second fetus becomes a super fetus to that. So usually happens, see, during the first trimester of pregnancy, a ovum might be released. Rarely, but it does happen. So a ovum might be released during the first trimester of the pregnancy. So she is already a pregnant female, and this ovum gets fertilized. Okay, so fertilization of a second ovum in a woman who is already pregnant is called as superfetation, and the fetus is a superfetus. Now, cannot the same thing happen over as superfecundation? Yes. So among these two fertilized fetuses, one might die. The dead fetus may come out by natural abortion, or it might get compressed by the ever developing fetus. And fetus preparations, yes, definitely can happen in superfetation. But as they say in the textbooks, as they say in the theory, most commonly seen in case of superfecundation. This fetus preparations is more commonly seen with superfecundation. So fetus preparations, if it is a question and both of these are options, single best answer superfecundation. But it can also happen in superfetation. It can also happen in superfetation. Second, so when this twin pregnancy, it also results in twin pregnancy. Well, it depends on during the first trimester, during which part of the, during whether after 15 days or after 1 month, after 1.5 months, when was the ova released and when it was fertilized. Definitely the partners can be two different people. So there is a chance of, definitely there is a chance of twin pregnancy, and there is always a good chance that these two people, or the father of the twins, might be two different people. The same thing can also happen in superfetation. Okay, both can happen, but luckily that was not an option for you. Okay, fine. So that is superfetation. Then what is supposititious child? Again, I have taken it from directly notes. Everything is given in the notes. Supposititious, supposed to be her child, but not her child. That is to say, so this is intentionally faking a pregnancy, voluntarily or intentionally faking a pregnancy. So this lady just goes on increasing the girth of the abdomen, and one fine day she produces some other child as her own child, mainly for property inheritances. That is supposititious child. Okay, atavism. That is, you know what is atavism? The grandparents' characteristics coming into that of the grandkids. That is different. Posthumous child. Again, there is, yeah, there is a question on the, I mean, the definitely question does appear in a posthumous child. Posthumous, the word itself says after death. So posthumous child is the one. Well, I'll just take note over here to explain that posthumous child. Posthumous child is the one which is born after the death of the alleged father. The child being born after the death of alleged father. That is, the lady becomes pregnant during the continuation of the marriage. Unfortunately, the husband dies while she is pregnant, and she delivers after the death of such, the dead husband. So such a child is called as posthumous child. Okay. Well, there is also one more word very similar to this. I have just taken the screenshot of that also. We'll discuss that. False pregnancy. Very frequently as false pregnancy, also called as spurious pregnancy, pseudocyesis, or phantom pregnancy. Pseudocyesis, phantom pregnancy, or spurious pregnancy. See, this is many times it is mistaken by the students for supposititious child. No, false pregnancy is intense desire of the female to get pregnant. She's not faking it here. She's not faking it. Because of the intense desire to get pregnant, she starts getting the changes of pregnancy. She starts feeling that. She becomes amenorrheic. She starts feeling the bloating of abdomen. She even starts getting quickening movements. She starts experiencing quickening movements. Okay. Sometimes even to the extent of experiencing the labor pains. So that is the intense desire of a married woman to get pregnant, which makes her to feel that she is pregnant. That is pseudo pregnancy. Okay. So with this, we have discussed very important points pertaining to this particular question. Let's move to the next question now. Well, the next question is not suggestive of cocaine poisoning. Not suggestive. Agitation is seen, hyperthermia is seen, bradycardia is definitely not seen. Bradycardia is definitely not seen. Now, before I go, what I can say into the other parts of cocaine, see what are the clinical features. I'll just tell you the clinical features. See, cocaine is always followed by, after consuming cocaine, what we call as rush and crash or crash. Crash or crash. That is, initially, rush is a sudden rush of emotions and sudden rush of everything. So this phase is what we call as euphoric phase. Again, I would take note here, which better explains the condition. Okay, so initial phase is called as euphoric phase, or what we call as phase of rush. So during this euphoric phase, everything is increased. Everything is increased. So what is increased? So pulse rate is increased. Okay, pulse rate is increased. Then temperature is increased. Then respiratory rate is increased. Then reflexes are exaggerated. Reflexes or exaggerated. Reflexes are exaggerated. Okay. So during this stage, everything is increased. There is tachycardia, there is tachypnea, then respiratory rate is increased, reflexes are exaggerated. So all these three things, it's an euphoric stage wherein the person becomes extremely talkative. So talkative. And the other important point during this phase is tingling and numbness. So tingling and numbness. So tingling and numbness of the fingers, of the lips, of the tip of the nose. So this is one of the very common finding that is seen during the acute phase. Okay. Now initially the person's become extremely euphoric. He forgets about all the problems in his life. And this period of rush is only for about 30 to 60 minutes. After which he goes into extreme depression. So to come out of this depression, he has to snort this or take the cocaine again. So this vicious cycle keeps repeating. So remember that in case of cocaine, everything is raised. Temperature is raised, pulse is raised, respiratory rate is raised, reflexes are raised or exaggerated. Okay. Well, so now let's look into a few important points regarding cocaine. Okay. So cocaine, just take a highlighter, which will be easier for us. So obtained from coca leaves. Obtained from coca, that's also a question. Slang names of these are very frequently asked. It's called as white lady, coke, snow, Cadillac. Questions for you. White lady, coke or Cadillac. This is also a question. Cigarettes containing cocaine are called as crack. Cigarettes containing cocaine are referred as crack because they give the typical crackling sound when they are smoked. So cigarettes containing are called as crack. Okay. The rest of the thing, don't worry about this. In detail, again, this is not a session wherein I want to go into detail. So you want to go into detail about cocaine, again, definitely refer to the notes. Most common usage is by snorting. Most common usage is snorting. Now, other important features of cocaine, I'll just be noting that because cocaine is a repeated question. Actions, it's a local anesthetic, it's a CNS depressant. Signs and symptoms just explained, rush and crush. So initial stage of excitement lasts for only 30 to 60 minutes, followed by intense depression. Again, he goes, snorts it and goes for it. Okay. And features of acute cocaine is, as I told you, everything is increased, pulse, respiratory rate, reflexes, temperature, everything is increased. Okay. And tingling and numbness. Remember that important thing. Treatment, amyl nitrite, specific antidote. It is said to be amyl nitrite. Okay. Then chronic addiction is the frequent question for us. Chronic addiction is the one which is a frequent question for us. Okay. So what are these? Also called as cocainism, cocainophagia, cocainomania. So what are the cocainism, cocainophagia or mania? What are the features of that? So first of all, black discoloration of teeth and the tongue. Black discoloration of teeth and tongue. Painless perforation of nasal septum, frequently asked, because most common modality is snorting. Painless perforation of nasal septum. Then magnum symptoms, also called as cocaine bugs or formication. The most frequently asked question in cocaine. Magnum symptoms or cocaine bugs. These are tactile hallucinations. Tactile hallucinations. He feels that something is crawling. Okay. And then bruxism. Bruxism. So cocainism is characterized by blackening of teeth and tongue, painless perforation of nasal septum, tactile hallucination, bruxism or grinding of teeth. Okay. Medical legal importance. Cocaine is the second most commonly used illicit drug in the world. Second most commonly used. The first most commonly used drug is cannabis. Cannabis is the first world's most commonly used illicit drug is cannabis. World's most commonly used illicit drug is cannabis. Second, cocaine. Cocaine. And this is the one which is again frequently asked. Cocaine plus heroin mixed and given IV is called as speedball. Speedball. Cocaine and heroin given IV referred as speedball. Okay. Well, that's about cocaine. Next question. A 55-year-old patient from Chhattisgarh presents with progressive muscle weakness, stiffening of both lower limbs and complete motor paralysis. What is the most important history to be asked? I'm not sure about the options, but definitely diet history is the most important history to be asked. Definitely this question I feel it pertains to forensic medicine also because it deals with what we call as Lathyrus sativus or Kesri dal. Lathyrus sativus, or also referred as Kesri dal. Okay, it's a staple food in some parts of the northern India. It can be grown during any part. I mean, most drought environment it can be grown. Active principle, a repeated question. Active principle of Lathyrus sativus is BOA, beta oxyl aminoalanin. Beta oxyl aminoalanin. This itself is a question repeatedly asked for us. So consumption of this Kesri dal every day to the extent of 30% of the staple diet per day. So when it is consumed as at least 30% of the staple diet every day for 6 months, so there will be neurolathyrism. So consumption of Kesri dal for more than 30% of the staple diet for more than 6 months every day results in neurolathyrism. What is neurolathyrism? So there will be progressive spastic paraplegia with preservation of sensation. Spastic paraplegia, preservation of sensation, preservation of sensation and pinchers and mental activity. He will be alert. So initially back pain followed by weakness in the legs, difficulty to sit and stand. We call that as single stick stage, double stick stage. So initially difficult to sit and stand, then difficulty to walk without a stick, then finally complete paraplegia. Complete paraplegia. Back pain, weakness in the legs, difficulty to sit, walk, stand without stick, complete paraplegia. So how this can be overcome? So this can be overcome by soaking the Kesri dal in hot water and boiling it. So by mixing it with hot water and boiling it, 90% of the toxin can be removed. So this is how it can be overcome. Okay, 90% of it can be removed. Lathyrysm or neurolathyrism by Kesri dal or Lathyrus sativus. Okay, so that's of all the forensic medicine questions which did appear. Wishing you all the best for the results. Okay, thank you.